I picked this talk today in part because when I was on the Cape, I used to volunteer to screen kids at Barnstable High School every year. And I want to see a show of hands. How many people in the room have children or grandchildren who are playing sports in high school? Okay, so it's a lot. Okay. So the reason I picked this talk this year is that in March of this year, something caught my eye, and that was a headline with 3 young athletes had passed away all within 1 week. 2 were boys, 1 was a girl, and they played different sports. And the headline was, is it really safe for our young athletes to be playing sports at all? And whenever you read this, if you have a child or a grandchild, you worry a lot. You worry because biologically, I don't think we were designed to have our children or grandchildren pass away before we do. And it's really probably one of the most tragic things that truly affects any parent if it happens. And so what is it? Sudden cardiac death is really rare, but if it happens, it's catastrophic. About 1 in every 200,000 athletes will die every year because of sudden cardiac death while playing sports. So you saw the headline that said 3 deaths in a week, but if you really put it in perspective, it's quite rare. When do they occur? Over half of them occur in high school kids. Most of them occur while the kids are playing. And most of them occur in young boys. If you take a look at the distribution of which sports, you will notice that basketball and football are by far and away the sports which are associated with the most incidences of sudden cardiac death. Track is next, but it's really the first 2. And the question is why? I mean, if you're a parent sitting here and your kid swims, you can relax a little bit. But if you're a parent sitting here and your kid plays basketball, you have to worry a little bit and say, what's going on? And I think this is the reason why. So this is a very busy slide, but it tries to break down why are these kids dying. And if you really take a look, the biggest, let me go back one. The biggest part of this pie is something that says HCM, which is hypertrophic cardiomyopathy, which is an abnormal thickening of the heart muscle. That by far, in a way, is the reason why most kids die. If you add to that normal thickening of heart muscle with exercise, and that's what's called LVH, left ventricular hypertrophy, you can see that pretty much almost half of all sudden cardiac deaths are really because the heart muscle is abnormally thickened. And if you go back, it is these sports where you find hearts that are thickened. And kids with thick hearts that can produce explosive power are the kids who do well in football and basketball. And I think that's why you have this cluster of sudden cardiac deaths. And this is what it really looks like. So these are 2 hearts taken from real people, and that's what a normal adolescent heart should look like. And this is a heart of a kid who died suddenly with hypertrophic cardiomyopathy. So it's a massive abnormal enlargement of heart muscle. And there is a little bit of a racial distribution, and that is, unfortunately, African Americans tend to have more thick hearts, abnormally thickened hearts, and part of it is genetic. I'm not clear whether it also explains why you find a lot more African Americans playing basketball and football, but clearly there is a genetic component that will need to be explored. And so what can we do about it? So there's something called PPS, which is pre-participation screening. And in some countries, and the country in mind is Italy, they mandate all of their high school kids and college kids be screened. And if you fail the screening, you are not allowed to play sports. And I will show you the results. And the results are actually impressive in a way. But the first point I'd like to make is it's quite unclear whether in this country we will ever allow a physician or a governing body to deny a kid from playing sports. I don't know if you recall, but a few years ago, there were quite a few lawsuits flying around the country where some college kids were barred from playing sports after an episode of sudden cardiac death. And those kids sued the schools, and it was a very expensive, messy proposition. So I'm not quite sure whether that will work in this country, but I will show you the Italian experience. So for the Italian experience, every child who plays sports has to get an EKG every year between the ages of 12 and 35. And if the EKG is abnormal, they can't play sports unless they see a sports specialist who has to clear them to play sports. And these are their results, the Italian experience. So this graph is the rate of sudden cardiac death of kids who are screened. And over time, you can see that it really dropped to wonderful low numbers. So one can say, as a country, Italy has done quite well with their screening program in reducing the risk of this rare event. What are the problems? So the first one is that for many of the physicians in the room, you know very well that no test is 100%. And so up to 10 to 15% of tests will be abnormal, not because the kid really has a problem, but they're just a false positive test. And those kids and their parents will be worried. They will be initially denied playing sports. They will go on to have more expensive testing. And if you take a look at the Italian experience, up to 4% end up unintentionally being excluded from playing sports. So this is a normal kid that you have labeled for the rest of his or her life and affected their life because now they can't play sports. And again, 4% is a very low number. One can say, if we take a look at it from a public health standpoint, maybe we should do it. But if you are a kid in that 4%, or you're a parent in that 4%, and sports was the ticket to your kid's scholarship to college, it's not a benign event. So what do we save if we screen everyone? This is the Italian experience. For every 200,000 kids you screen, you save one life. So as you can tell, it is a lot of effort per life saved. And for all the kids, the other 9 that you're going to tag as abnormal, psychologically you affect them, financially you affect them, and as I indicated, career-wise, suddenly maybe they won't get the scholarship to go to college, and their trajectory in life changes permanently. So it is something that one needs to be quite careful about how we do it and to be quite sure about the results. And when something is such a low probability, for people who know statistics, you know that if the probability is this low, most of the time if a test is positive, it's a false positive test. So what are the 2 modes of testing that are used? I think, as I indicated, in Italy and in many other parts of the world, they start with an EKG. And then if the EKG is abnormal, they move on to an echo. So I'll talk about those too. And I'll start with an experience from our very own country, Nevada. They screened about close to 6,000 high school kids with a history physical EKG. And then if any of those were abnormal, the kid ended up getting an echo. And out of the almost 6,000 kids, they disqualified 22 high school kids from playing sports. And then they went back and looked at what was most helpful in weeding out those kids. So if you go by history alone, history did not help. And I'll come back to that at the end because I think history actually is quite helpful. If you take a look at abnormal blood pressures, really only one kid out of 1,000 did you find a blood pressure that might say go for further testing. The physical exam was absolutely not quite helpful, and probably the only thing that marginally helped was the EKG. Out of every 350 kids, one EKG would be abnormal. And you would say, okay, maybe you should send the kid on for further testing. Well, what's the problem with that? Well, I think the EKGs are quite dangerous, actually. So if you think about it, they're projected as a very cheap test, $25 to $50, and so one can say, not a lot of money, maybe we should do it, maybe we should become Italy. If you take the $25 to $50 and you multiply it by every high school kid in this country, the bill every year just to do the EKGs would be between 1 and 2 billion, just to do the EKGs. And as you know, as a country, we're broke. I don't think we can add 2 billion a year just for the initial screening of the EKG. What else is the problem with this? So up to 15, and actually I'd say close to up to 20% of the EKGs are actually abnormally normal, meaning most young athletes have an abnormal EKG. And if you use the regular criteria we use for normal, we will end up calling them abnormal, but they're really quite normal. And this is a case of a real athlete who was denied participation in sports. For the physicians and the cardiologists in the room, if you take a look at this lead over here, the STs are very abnormal, sort of V2, V3, V4. And this is an EKG where absolutely everybody in their mind and mindful of lawyers would say the kid can't play. This kid went through every test you could do, including an MRI, and he had a normal heart and was cleared to go back and play. But that workup up to the MRI was tens of thousands of dollars, and a lot of anguish on the parts of the parents and the kid as to, am I really normal, am I not, can I play, can I not? So I would actually venture to say that although the initial price tag of the EKG is quite cheap, it is probably quite a dangerous weapon in most hands. So if you go back to both the Nevada high school experience, and if you go back to the experience in Italy, actually, if you take a look at the cost of how much more does it cost incrementally in healthcare money for every EKG you do, it ends up costing about $44,000 per life year saved, which is quite a bit of money. And if that is a hard way of thinking about it per life year saved, we can flip it the other way and say, for every life you save, how much more money are you spending if you do the EKG screening algorithm? And you're spending about $3.3 million per life saved. And as I said again, as a country, we're at the stage where I'm not sure we have the budget to undertake such an enterprise. So the second test that we do is an echocardiogram. Echoes are a little bit more expensive, depending on where you are, 600, 1,000, 800. Again, as I indicated, most kids die because of a thick heart. And these are two echoes, and again, these are live examples, real examples. And you can see in terms of thickness, the thickness is the same. It's abnormally thick, both hearts. But one of these is abnormal and shouldn't play sports, and one is normal. And I would venture to say, if we are honest, almost everybody in this room, and by the way, this again is a kid who went through multiple centers, multiple testing, but based on this alone, you can't tell which heart is the normal one and which one is the abnormal one. And again, the reason for that is most athletes, because they train a lot, do develop a thickening of the heart muscle, left ventricular hypertrophy. And that can be almost as thick as somebody with a cardiomyopathy, with a hypertrophic cardiomyopathy, and it becomes very hard to know which is real and which is Memorex. And in the clinical world, you're then faced with the dilemma, should I do more testing? And more testing means cardiac MRIs, maybe biopsies, maybe Holters, or if you have time, in the common sense clinical world, you tell the kid to stop playing sports completely for about 6 weeks. And if a heart muscle is thickened just because of playing sports and conditioning, within 6 weeks you begin to see it thin out a little bit. So you bring them back and you do another echo. And if they're beginning to regress, you can say, aha, this is a normal heart that thickened because of exercise. It's not a cardiomyopathy. But many times you get the kid in the spring, right before a championship somewhere. No one is going to stop them from playing or training for 6 weeks. And you have to bring them back for the second echo. So it's a lot more money. So again, it becomes quite an undertaking. So an echo is, again, in the wrong hands, quite a dangerous and expensive tool. So if you take a look at the cost of life per year that we save, I indicated the EKG was $44,000. A history and exam, if you just have every kid have an H&P by their PCP or by a cardiologist, will cost about $84,000 if we employ that as a screening strategy. And the echo is $200,000, which is why I think having that in the screening algorithm becomes very expensive. So what do most kids do if they end up having an abnormal EKG, abnormal echo? The next thing that we usually do that ends up helping in terms of being a tiebreaker is a cardiac MRI. And a cardiac MRI is about $3,500 if you're lucky, to up to $5,000 depending on where you go. But what a cardiac MRI is good for, and these are two examples, is if you do a cardiac MRI, and this is heart muscle, and you see white stuff, like over here and over there, in the middle of the heart muscle, that's scar tissue. And if you ever see that, you can be pretty sure that this kid does indeed have hypertrophic cardiomyopathy, and they should not play sports. They are really, truly at a risk of sudden cardiac death. And it is probably the best non-invasive test in helping you sort out which way to go, but as you can tell, it's quite expensive. The next one that is beginning to be very popular is genetic testing. And so this would be in a case where, and for example, I saw this mother yesterday. She actually lives in Chatham, but her brother died suddenly of sudden cardiac death, and she's got a couple of kids who are teenagers now, and one or two of them have had episodes of lightheadedness, almost passing out. And the question is, did they inherit the same thing my brother did? So one of the things you can do is you can do genetic testing. So it's not done everywhere. You have to go to a few places in the country, and it has to be tailored, and it's quite expensive. I put $3,000, but it's really closer to $5,000 maybe. It's not covered by insurance, so parents will have to pay out of pocket. And there are two problems with genetic testing, 2 or 3. I usually tell everyone before you go there, you should think very carefully, what are you going to do with that information? If your kid has the genetic mutation, it doesn't mean that 100% of those kids will develop the disease. There's something called incomplete penetrance. And so some of us will have the mutation and will be fine for our entire lives. And others will have the mutation and at the age of 35 will die suddenly. And in today's world, we don't have any tools to predict which one will be what. And so you can take someone who was normal and you can tag them permanently as abnormal, and they live every day with the dread that I could drop dead, and maybe they never will. You end up affecting how they choose to live their lives. You end up affecting how and where they will get insurance, medical insurance, life insurance, disability insurance. We have HIPAA rules to protect medical records, but these things leak out. And once you have it on your record, it becomes very hard to expunge, and insurance companies do find out. And unless you end up being lucky and you get a job in a place with a group policy, you can very quickly be excluded from most forms of insurance. So it's something I tell everyone to think about very carefully before going there. So what are the current recommendations in this country? So the current recommendations are Guidelines were developed by the American Heart Association. It's a 12-element guideline, and they strongly emphasize personal history, family history, and the physical exam. And they recommend that you refer any student with a red flag for further testing. So this is really Italy light, okay? It's really kind of following the same thought process that Italy used, but not mandating it, but just saying this is a guideline. But as I indicated, if you really go with that approach, we will end up bankrupting our healthcare system even faster. We just can't afford that, really. And so what do I think would be effective? And this is probably the only slide I want everyone to remember out of my whole talk. I would say for every parent and every grandparent, if you're sitting around at the dinner table, it doesn't have to be an inquisition, but it's nice to know, has your kid or grandkid ever felt like passing out while they were playing sports? That one question really identifies the kids who are high risk. And if you ask nothing else, no physical exam, no other history, nothing, just that one, and you just take all those kids and you look at them a bit more carefully, that's where the money is. Because all of these kids, if you go back, have had multiple episodes of nearly passing out or passing out, witnessed by their friends before the final event that takes them, okay? So sit with your kids or grandkids, casually ask every once in a while, how are you doing? Has that ever happened? And if it has, you should really talk to their physician. And if you recall what I said about the EKGs that can be read as abnormal and echoes that can be read as abnormal, I would recommend, if that's the case actually, to really do the kid a favor, skip the pediatrician, skip the regular cardiologist. You want to go to a place where they do sports physiology, where they have thousands or hundreds of thousands of EKGs they have seen of athletes, and they can say, aha, this is a nothing and don't worry. Where they have hundreds of thousands of echoes they have done of athletes, where they can say, this is within normal limits, or this we should worry about a little bit more. And if you can do that alone, I think you will probably get half the kids. You will. Just by talking to them, you will. The second thing I would recommend is for every parent, every student, every coach, once a year, they need to learn CPR, and they need to learn how to use an AED. How many have AEDs in their offices and schools? One. It's a crime. Because if this were to happen, the only way you're going to save that kid is by shocking them within the first 5 minutes. Okay? It's really the only thing, because all of these kids die of an electrical death, an arrhythmia. Okay? And the only thing that will save them is to defibrillate them within the first 5 minutes if you want no brain damage. So everyone should be trained on how to use an AED and to do CPR, and they should be in every sports venue, every place. The bus that's taking the kids to wherever they're playing, so that if they don't have an AED, you have your own. Every gymnasium, every track field should have one. And once a year, everyone should get a refresher, because really the key is time. Time is the essence when these events happen. And that's not the time you want people fumbling around saying, what should we do? Who should we call? So I would say you should insist in every school that they start a program where everyone has to get CPR training once a year, and everyone has to get trained to use an AED. And if you do that, you will get probably another 40%. So you've captured about 90%. We can never be 100%. And you can do that by spending very little money. The last thing is, as communities, I think one should develop very clear guidelines and emergency plans. So it's not just that if an event happens, we will call 911. But you need to talk to your dispatchers, your ambulances, your hospitals to say, we need a special code. If we call, we can say, athlete, and everybody knows. It will make a big difference in that kid's life. If it takes them 8 minutes to be shocked, and then they get to Hyannis, and they're still warm, and they end up staying warm for the next hour or two. And those are the things that I think communities can do to try and address this problem. Thank you very much.